Okay, we just completed roll call and have a virtual attendance for Michael Maestri, Chris Rusk, Dawn Pettit, and Sabrina Dunlap.
It still says.
No, right down here it says, yep.
There's someone else
They're muted.
online as well.
It says unmuted.
Oh, it is unmuted. See down here? Can you hear us online?
I can hear you now.
Yeah, I can.
This sign doesn't go away.
Okay, are we ready?
Yep.
Okay. If we could stand for the Pledge of Allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Certification of compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin.
Okay. Meeting agenda. Can I get a motion to approve the agenda? Second, everybody in favor, say aye.
Aye.
Aye. Oh, thank you. Meeting agenda. Public comments. Do we have anybody from the public here tonight? Or on? Is that somebody? Okay, nobody on. Okay. Consider approval of the minutes from previous meeting.
Motion to approve the minutes.
Do I have a second?
I'll second it.
Thank you. Everybody in favor, say aye.
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 Motion passed. Committee reports. Do we have anybody from LCO to replace Lorraine? Does anybody know who we need to contact to request?
I would say Tweed.
Is he back in town now?
Yes.
Okay. All right. Yeah. Okay.
Do you want to do that or do you want me to come in?
Will you see him before I will, or?
I can email him
Okay.
and see
Yeah,
what
go
we can
ahead.
get. Some
Please.
things booked out. Okay, I'll follow up on that.
Thank you. That would be great. Okay. Do we have anything from Senior Resource Center? Okay.
I can just say that the Senior Resource Center has tickets available for their big raffle for the event. So if it's a grill package and second and third prizes. So if anyone's interested, contact any member of the Senior Center.
Okay. Administration.
Okay. Andy, did you have anything? Okay. We have gone ahead and chosen September 12th as our first all-staff meeting that we had agreed upon last month. And so looking forward to that. We are still looking for, we're going to secure location, but we do have it booked on people's schedules, and we'll get that posted up for the public as well. We have been meeting together as leadership team, trying to make sure we're ready and prepared for that first all staff, prioritizing what we want to go through, and really communication has been kind of the work that we've been working on in the last month. Just started sending out a weekly messages to the staff just to keep them updated with all the changes that are occurring, and started a newsletter this week. So hopefully that will help with all of the changes that we have going on within all of the different areas of the departments, as well as we're working on painting offices and getting people moved into locations that are closer to their units. So been busy with that. That is it for the leadership update. The next thing is WIC merger. If I can move on with that. Oh, go ahead.
The September 12th, is that intended to shut down
Shut down.
services to the public?
Yes.
I know it was discussed at last month's meeting. I don't know if it's required, but might be good to have the Human Services Board approve that 12th because it's a change in schedule. And
Okay.
services will be closed to the public.
We
Okay.
approved the meetings.
We talked about it last month, but we didn't do it
but
though.
we didn't-
We didn't have the exact date.
Yeah.
We agreed that we would do that. So yes, we can certainly, yes, services will be closed down for the afternoon, 11:30 to 4 o'clock on September 12th.
Okay, now we need a motion.
I'll make a motion to approve the Health and Human Services all staff meeting for September 12th, 11:30 to 4 o'clock.
And a second. Thank you. Any comments? Questions? Everybody in favor, say aye.
Aye.
All right.
Okay, motion passed. Go ahead and proceed.
Okay, I'm going to go ahead and share. If I can move this around a little bit. Okay, so we are been in the process of talking about merging our WIC services with 3 other counties. We've been looking at this for over a year and a half now. And as we go through the PowerPoint slide, it'll explain some of the reasons and things associated with looking into the merger. The counties that we would be working with are Polk, Washburn, and Burnett. Just to kind of make sure that we're all on the same page. When we think about WIC services, it's Women, Infants, and Children's program. It is a nutrition program that helps with breastfeeding support. It is a food benefit program as well. We provide nutrition education and make referrals to community resources. We also have farmers market supplements that go out during the summer. They receive WIC checks that they can use at farmers markets. All of the clients that are in the program meet with a registered dietitian every 3 months for a nutrition eval. And during COVID, that has all been happening virtually. And now that the emergency has been lifted, we will be starting to do those visits in person again. People that are eligible for WIC are those who are pregnant now or have had a baby in the last 6 months, if they're breastfeeding, and for children that are under 5 years of age. They must live in Wisconsin and meet a household income based on size. When we think about the merger benefits, the reasons for really starting to think about this is it should save us time and money in the long run. What happens is for an administratively, each WIC program has to have a WIC director, and we each have to turn in and monitor and go through things individually as each county. By merging all of us together, we only need one WIC director, and then with that, that'll all go into one document, and it will save administrative costs and time associated with the program. One of the other major things that we're finding with the program and why we started to be really interested in it is registered dietitians are as difficult to come by as RNs are. And so the other problem is we're such a small county, we can't hire a registered dietitian full-time. So they have to have multiple jobs in order to make ends meet. So with this program, what we are able to do is combine the registered dietitian and be able to offer full-time employment as well as benefits, and then be able to work with them across the 4 different counties. So, and that is the same as well as our clerical staff. Clerical staff have not been able to take time off. They're the only ones. It's kind of a one-man show. So having time off during the time that we'd be scheduled for WIC clinics is always difficult. And when they are off, even being able to cover for if people needed help getting their cards replaced or needed to get on to the program immediately, we have to work with other agencies or train up other staff to be able to fill that in. Now we'll be able to have multiple backups as we move forward. Kind of went through a couple of slides here. The other thing is the phone lines will be also monitored all the time. And so that will be readily available. And people will be able to have virtual visits on clinic days that might not have been available here. So if a registered dietitian has clinic hours set up for Polk, and somebody from Sawyer County really could only meet at that time, they could just jump into those virtual visits. So it should be better for all of our clients as well. So a review of some of the things with the merger benefits, its efficient use of staffing, will have an increased availability of services, again, appointment location flexibility for them. We will be able to purchase like Google Voice for one account instead of multiple accounts. So we'll be saving funding in that respect as well. And again, looking at a better retention for staff so that we have more balanced workloads, more expertise in the program. The nice thing about this merger coming up when it has is we have been able to start talking about this early on before we really had the staffing crisis, where other counties we were seeing being folded in when they weren't really ready to merge because they just didn't have a choice because of staffing. So, so this has worked out really well. This is an overview of the current caseloads. Burnett has 235, Polk 393, Sawyer 275, Washburn 215. And that's a total of a little over 1,100 with the caseload. 2.3 FTE support staff and project nutritionists at about 3.5. And as we merge in, we'll be able to reduce some of that staffing with just one project with project director. One of the things probably we haven't really discussed is I technically am the project director for WIC. And so it'll be nice to be able to move this on to somebody who kind of lives and breathes WIC instead of me kind of piecemealing that in for them. So I think we'll have a much better program support as we move forward. We're looking at the budgeting for 2024. We will be really solid on the budgeting because of how we start to merge in. They give us benefit, or they give us a little extra dollars as we try to merge programs. They're encouraging many counties to merge different types of programs to save resources. When we get into the 2025 budget, we are looking at a much tighter budget. We've always needed to put county money in. We do budget for that. We did budget for it in 24. We're not expecting to need to use that. But even though we will save dollars, we still might have to have county funding into that. So I just don't want to set us up to believe that we're totally not going to have any county investment in the future, but it should be less and it should be much better as we move forward. One of the other things that we're really going to be looking at as well is increasing the program. As we increase the program, we will be able to get more funding in. That is one of the ways that we're going to work on balancing our budget as we move forward. One of the things that we're looking at is those that have Medicaid would automatically be eligible for WIC. And as we look at the different programs, we can see that that's for Sawyer, we have an estimated 563 that are eligible. We serve 294, so about 50% are covered there. So we really want to do some outreach to see if we can get more people into WIC programming. The other thing that we're starting to see is because the food share benefits have gone down after COVID, people now are coming back on to WIC. So it's a little bit more work to get your benefit because you do need to go through the nutrition programming, work with the nutritionist, have appointments. Food share was a little bit easier in that respect. So if people were flush, they would kind of not use their WIC benefit. And we're starting to see them going back to using that now. So as we move forward, all of us are bringing this discussion to our boards to see if there's anything that we might have forgotten or need to consider along the way. In September, we will be looking at signing memorandums of understanding right now. Oh, and one thing I didn't mention is Polk will be the fiscal agent for this program. And so the MOU is in with their corp counsel, and then that will come over to go to the rest of our corp counsels to be able to review that memorandum of understanding. We do want to try to finalize the merger by October because we need to start scheduling clients in for January. So we do have to kind of make sure that we're moving forward timely. And then we also want to be looking at finalizing staffing and workflows. The one other point I want to make with staffing is Kathy Becker has been with our WIC program for over 20 years. And we don't want to change that by any means. So she has been fully informed. We are keeping her on as an employee of Sawyer County. If for some reason Kathy ever decides to leave or she retires, then at that point, Polk will then take on that hiring responsibility. But one of the big things of going into the merger was that we would retain our staffing. The other thing is our registered dietitian actually works for Polk County. She was working for us. Polk County had an opening. She went to Polk County, so we'll just be merging her in, so she won't be losing any time either. So, and Shar Yeagle is the other support that we have, and she has recently moved to Arizona. She's helping to support us virtually, but once the merger ends, then she'll be done with that. So just wanted to assure everyone that our staffing, we're taking care of our employees along the way. So, questions?
Okay, does anybody have any questions, comments?
I had a question. So Polk County is going to have the director.
So,
And then the other counties will contribute towards that salary and benefits?
yeah, so how it works is once we fully merge, all of the dollars will from each of that would have typically been coming into each of county would go directly to Polk County to then make sure that we have the services and we provide everything. So Polk County will be hiring the WIC director that will support all of those programs.
How do you decide how much each county contributes?
It's based on the caseload. So the number of clients. So if we were over, so say we're over budget, they're going to work really hard not to be. But if we were not able to meet it with the funding that comes in for WIC, it would be, we would look at what the differential is and split that by caseload. So the number of clients that we're serving. So Polk County is bigger, they would put more money in. Whoever's smallest would put the least amount of money in would be how that's determined.
Okay. We need to pass this on to the county board.
I don't
This is,
think at
this is
point-
an administrative
Yeah.
decision.
This administrative.
Hmm.
Okay. So,
I wanted to just share this with Julia now in the meeting. I don't know if it's come up within your group. We just had a brief discussion with our administrative colleagues. And this was just tossed out because I think this has been in the works for a little while.
Mhm.
But with the state budget, the shared revenue changes, they created an innovation fund for
Mhm.
consulting and services. Is that
We just started asking about it to see if we would still be, if we could be eligible for it. We started talking about this before that, so we don't know if we would be, but we are looking to see if we would be eligible for that.
just the comment we had,
Mhm.
a quick discussion was the timing of it might be a little off, but if we can find out if it would be eligible, it might, make sense to somehow delay the actual, not this part,
Mhm.
the actual effective date, and so it would qualify.
So that we would qualify. So yeah, we just
it-
started to talk about that. One of the things that is potential to do is to contract for services for an additional time. That is actually currently what Washburn is doing. Their registered dietitian retired back in February. So they've been contracting for services through Polk County. And that's kind of been our kind of soft entrance into what a merger would look like. So they're working through that. So good point. We just brought it up at our last meeting because we noticed that was in the shared revenue.
And we're still, it checks some of the preliminary boxes as far as transfer of services and cost reduction, but there's not a whole lot of detail that's come out about that innovation
Mhm.
fund yet.
So there you go. We'll bring more to the table as we hear about it.
okay, any other questions, concerns? Thank you, Julia.
Mhm. Okay. You want me to move along? Okay. The adult long-term care unit, we don't have a report this month. Carol is the new supervisor, Carol Martin, and is in the process of learning everything there is about that leadership role. I haven't had a chance to sit down with her to put together what a written report would look like. Everything seems to be going very smoothly there. She's jumping in, making decisions, helping staff meet their daily work. One of the things that did occur over the last weekend is Sawyer County We Care is a caregiver network to encourage people to become caregivers. And there was a walk and roll. It was a walk. Was it a 1 mile walk, 2 mile? I can't remember how far that walk was. But go ahead. Yeah, it was to encourage people to get out and become caregivers. The dementia specialist was at the event to be able to share information. So that was one of the things I wanted to update on. And does anybody have any questions on the adult long-term care unit? Okay. Moving on into the behavioral health, the report is there from Alicia, as well as the mental health cost by client report. Does anybody have any questions for Alicia? I see that she's on, or I don't know if you have any additions to add.
Keep
I
going.
don't have anything to add, Julia. If anybody has any questions, I can answer.
I'm not seeing anything. Thank you for being on tonight.
Sure.
Child Protective Services. We are really focused in on training right now. We have 3-4 new people that we're working on getting trained up. We now have been able to get trained enough where we're able to take call and not needing to use additional counties to help support us in that. So it's feeling good to be able to be self-supported in our program. Everybody seems to be working really well with one another. Season continues to be on as our half-time supervisor, who we've contracted with services for, and she continues to support that program. The other thing is that we are still in search of that supervisor, and we'll continue to keep that search going. Any questions? Okay. Youth Justice, we have the report included there. Shannon Kraus is now fully over and training in as our additional Youth Justice caseworker. And again, so we are in quite a bit of training and transition there, but that seems to be going well as well. Any
Yeah,
questions?
I have a question.
Mhm.
What is their caseload right now?
On the Youth Justice, I have to go and peek, actually. Yep, she's got 9 pending court cases. Rusk County has been assisting with ongoing cases, but we should be able to start pulling that back as well.
Okay,
So-
thank you.
Okay, economic support. Shauna is online with us tonight, and her report is included. Shauna, do you have anything addition that you want to add?
Just that we're busy. Our call center has really taken on a lot more calls over the last 2 months with the return of healthcare renewals. So one of the things that the state did was with our food share cases, there are certain cases and criteria where the food share interview is waived. So that helps us to get through our calls a little bit quicker, and then also to, continue to process those access applications and documents. So our call center answer rate is on there. We have a 96% answer rate. The longest wait time was just under an hour, which I know doesn't sound great, but especially with the long-term care calls, the calls regarding nursing home applications and benefits, those can be pretty time-consuming to get through. So all in all, I think that our statistics are very good, and staff are keeping up and doing a great job. We've authorized some overtime throughout the last couple of months, and that certainly has helped as well. So we're good.
Any questions for Shauna?
I had a question. So there are food share cases of 1,156, but recipients of over 2,000. How does that, those numbers work?
So the recipients are the number of the household members. So a case may have, 1 person or 6 people.
Okay. Thank you.
Yep.
Okay. Moving on to the public health report. Make sure I'm not skipping sections. Julie is here tonight.
Yes, Julie McCullum, Public Health. Just wanted to highlight a couple of items here. You'll note alpha-gal syndrome. I did include that in the report. A recent morbidity and mortality weekly report highlighted alpha-gal syndrome and noted that Northwest Wisconsin did have suspect cases in the time period that they were looking at. Just to let you know, it's an emerging tick bite associated allergic condition characterized by an allergy to mammalian meat and products. So it's kind of an interesting syndrome. And we have had cases, or suspect cases, I should say, in this area. It is not reportable, so it's not required to be reported to the health department, but through surveillance systems, CDC did note and want to get information out to providers, as well as let providers know about a geographic distribution. So we did communicate with our providers and also highlighted it on our biweekly public health update. Healthier Together Steering Committee met in July, and this is the overall committee that kind of gives gives aim and focus to our community health improvement plan. And we heard reports from each of the work groups as well as additional discussion items. And you're going to be hearing more about fentanyl awareness team as well as a part of this, this meeting tonight. Maternal, child, and family health emphasis. I did highlight Birth to 3 and WIC. Julia, you did a great job highlighting WIC. I just have some numbers for July, but also wanted to highlight Birth to 3. And this is a program that in the month of July had 27 individual family service plans open and 43 face-to-face visits in the month. They also provided their annual wilderness walk, which is an event that we host for families. 16 families participated for a total of 62 people. And LCO is also a community partner in that event. WIC caseload was 284 participants in the month of July. You can see WIC families spent $17,479 in WIC benefits in the month of June. So that's just 1 month prior. Julia, you already mentioned that we'll be returning to face-to-face visits. I did make mention of our trainings, and also we still have the opening positions that we're working on filling, which is the public health nurse role and the public health assistant role. Any questions? Thank you.
Okay, Lynn, do you have the link or do you want me to put the one for the budget? Okay, this thing. I can put this up on the screen because it didn't get out to everybody, right? Okay. To get started, actually, what we're going to do is Joyce Knowlton is a public health specialist who has been working with us actually since the start of COVID. She came on as a contact tracer and has moved into other things working with us. One of the things that we've been really alert and aware of is our overdoses and our overdose deaths and the fentanyl that is really been associated with all of these. So it's time, and and I think Joyce will be giving some additional data. So maybe I will just stop at that. We do have some serious issues in our county and want to be moving forward in a manner that we can really get awareness out and hopefully prevent overdose death.
Yeah, so in the United States last year, almost 110,000 people died from fentanyl overdose. To put that in perspective, that is like one jumbo jet airplane crashing every day. Wow. And people don't realize that it's actually a serious problem also in Sawyer County. So Sawyer County currently is #2 in the state for per capita overdose death. We're behind only Milwaukee. And as you know, Public Health did a gap analysis several months ago, looking at both substance use and mental health issues. And so we've been working to close some of those gaps. And part of what we discovered was that people just are not aware of the fentanyl issue. They're not aware of what is going on with fentanyl. And in Sawyer County in 2020, 2021, and 2022, each year we had 9 deaths, which doesn't sound like a lot, but we're a small county. In 2023, we've already had 9, and I believe recently we've added 2 to that number. It just hasn't been confirmed yet. So, and we're just halfway through the year. So we created a fentanyl awareness team. On that team is members from Sawyer County, all law enforcement agencies, Sawyer County Sheriff's Department, Hayward PD, Town of Hayward PD, LCO PD. We've met with all of the schools. We also have Stacy Hessel and Jim Miller on the board. We have Marie Basty and Dottie Crust who represent LCO. We have Kim Dale, who is a parent who has been willing to come forward and tell the story of her daughter and who passed away from a fentanyl overdose, as well as some community members, and of course, Sawyer County Public Health. Our motto is don't be fooled by fentanyl, your future depends on it. And as a result, we have created a presentation to explain what fentanyl is, why it is so dangerous, how it's getting into everything. And it's in every illicit drug you can think of. So in marijuana, the marijuana confiscated by law enforcement last year, almost 90% of it had fentanyl in it. Fentanyl is showing up in vapes. And that's very scary because we have kids who are vaping. So we really feel that we need to make the community aware and to educate them about what is going on and what to do about it. Part of what to do about it is Narcan. And so we became a Narcan distributor in public health, and we give training. We had put out a call to the Chamber of Commerce, and we got so overwhelmed, we had to create online training for people to take. So they can take the online training and then just come into public health and get Narcan. So Narcan is the only medication that will reverse an opioid overdose, that will reverse fentanyl. We found out, even talking to nurses who are used to administering fentanyl, you may be given some kind of fentanyl product when you had surgery or you had a baby or you broke your leg. But even they were not aware of the issues that are going on in Wisconsin, and definitely not in Sawyer County. So we've created flyers, banners, some stickers. We marched in the Muskie Fest parade and handed out information to attendees, as well as stickers for the kids. We were at the National Night Out for Hayward and the National Night Out for LCO, had a lot of interest. We've gotten no negative feedback from this. So many people are telling us it's about time. So I really think this is important. There's a schedule that I passed out there. That is a schedule of events coming up. So some things of note: we are doing in-service training for the teachers at LCO, Hayward, and Winter schools. And board members of all the boards are going to be invited to attend any one of those that may be, be advantageous timing for you, just so that you can see what's going on and so that they can see that you're interested. Then we've also received approval from Hayward to present to the student body, and LCO and Winter are just waiting for their school board's approval, and then we will do a presentation. And it's a presentation about fentanyl, what it is, about Narcan, but then it's also Kim Dale telling her daughter's story, and then also Sheriff Motek talking about the law enforcement side of it. So, any questions?
Go ahead. You have a question? Where does fentanyl come from? I mean, has it been around forever, or did it just pop up all of a sudden?
No, fentanyl in legal form has been used by doctors. It's a very effective pain medication. Mm-hmm. But now the chemicals are coming from China, and they essentially come into Mexico, where they have, the cartels have figured out how to make it. And so then the reason fentanyl is put into something is because it is so addictive that if you put it in marijuana, you're going to want more marijuana a lot sooner than you normally would. So they're going to sell more. Mm-hmm. And so that's why they decided to put it in everything. It's in everything. So they started in pills, and in the pills, you can't tell the difference unless you test it. You can't tell the difference if it's OxyContin or if it's OxyContin with fentanyl. So if you notice on those flyers, there's one that shows the tip of a pencil and a little white powder. That's how much fentanyl it takes to kill you. Very, very small amounts. Okay. Any other questions? All right, thank you.
Okay, so one of the things we just wanted to make sure that everybody was aware of all the things that have been happening. It's been happening pretty fast and furious. I think started in May, really, with the fentanyl awareness team coming forward. Kim Dale coming and asking if she could connect with public health as we move forward, looking at the opioid issues that we have in our area. And from there, it just has snowballed and moved forward. And we knew that we really needed somebody from the community to step up to be a part of this, to be invested, because government can't just push out onto the community. The community needs to be involved as we move forward. So we're really excited about that. As we start moving forward and thinking about the opioid settlement and where the funding can come from as we move forward with this, really, there's quite a bit of advertising to really kickstart this to move forward. So you'll see a bit of funding, a good chunk of funding in advertising, getting that message out there. The one thing that what we're hoping to see is with the Forever Joy website is that donations will come into that, and then that will help support that fentanyl awareness activities as we move forward. Some of the other things as we look at the budget, we have grants that are coming in that we can spend money on that is related to opioid awareness and moving forward with that. And other grants are becoming available, like we've just applied for and received a law enforcement grant. And so in order to move things forward, we're going to try as best we can to pay for things with grants that we can achieve in getting, and really use opioid settlement dollars as that back of being able to help support these things when we don't have enough funding. So as we look at the budget as we move forward, separated into 3 columns to just help you see that we're moving forward with a number of things that we already have funding for, and looking at where could we use those opioid settlement dollars and what can we get for law enforcement grants. If we get more grants coming in that we don't have to use some of the funding we requested, we'll absolutely do that and save that funding for later uses, because that time frame doesn't go away, whereas grants usually have to spend that money within a specified time frame. So just kind of want to set you up for what that looks like as we move forward. So we have harm reduction activities and salaries, which we're able to support through HHS grants. And then, see if I can get this to move. Oh, it moved too fast. And then when we think about, as we start getting into the schools and really doing some of those prevention campaigns, that's a lot of that prevention dollars. Some of that we're able to move into some grants through HHS. Other things we're asking for through the opioid settlement funding. Other advertising along the way. We really want to hit the billboards. We want to get the message out all at the same time so that we're really enveloping the whole county, so that people are talking about it and experiencing it as we move forward. And then the additional pieces here under support, there is School Pulse, which is well, actually, Joyce, do you want to explain that a little bit more, because she's been more involved in that? School Pulse and Kids Pulse is something that the schools are looking at right now, and it won't have been into their budget, so we'd like to support it in the first year to get them up and started.
Yeah, so School Pulse is a program, it's an online program, and it works mostly through text, and because that's what kids do now. But so let's say on Monday, if they text and say, hope you had a great weekend, how are you doing? And they just respond, I'm good, I'm bad, whatever. Wednesday, then they send out a podcast on their text that is something positive or educational. It's really about mental health awareness and feeling good about yourself. And then on Friday, maybe another check-in. The nice thing is, number one, this is an opt-in service. So if parents say, no, I do not want my kid to do this, it's not everybody just automatically is enrolled. And number two, their support. So they have had instances here in Wisconsin where when they ask a child, you know, how are you doing? They may contact them at 8 o'clock that night and tell them they're suicidal. They have licensed professionals there available for them at that time to talk to and to work to get them out of that and get them into some help. So it's not only for suicide, it's for drug usage. My brother is using drugs and my parents are fighting all the time. What should I do? But also on the other side of it, it's also available to parents. It's available to caregivers, anybody who cares for those children, grandma, auntie, mom and dad. So they're also getting contacts from the parents saying, my kid is doing this and I don't know what to do. And again, they have licensed mental health professionals there that know how to deal with these things. And so it's really support for the community and especially for our children. The Kids Pulse is a little bit different. So School Pulse is for age 13 up through 12th grade. The Kids Pulse is for the younger kids, and it's just an emoji system that they have touch screens set up around the school. So let's say it's when the kids are getting on the bus at the end of the day, and they just touch a screen that it says, how are you today? And they say sad, happy, they hit an emoji. So the school can actually see, okay, something's going on with our kids. They can get a report that says 52% of your kids are sad or upset. But if they say something like sad, it will also say, do you want to talk to somebody? So it gives them an opportunity to get that contact right away. And that's School Pulse and Kid Pulse in a nutshell.
So who are these support people? Where are they?
They're all over the place, but the company is out of Idaho, and it is we actually met him at a conference, and he gave a presentation, and it actually wasn't for his product, it was just for us as workers. And but then we started checking into him and then heard about his product and then contacted him for a demonstration. But it is professionals that they hire. So this is not, my concern is always, I don't want it to be, no offense against college interns, but I don't want it to be some college intern trying to get some credit who really doesn't care. These people are hired by them. They have to be, you know, licensed professionals of certain grades in order to respond. But it's all by, you have to realize it's all by text. So yeah, I know.
Yeah.
Sometimes you have to go to where they are,
Yep,
right?
and that's where they are.
Yep.
That's where the kids are. I know.
Yep. They have it, the schools that they have it in right now, they have a 98% retention rate. So kids can opt out at any time. They can say, nope, I don't want anything to do with this anymore. But 98% of the kids are hanging in there, which is a pretty good number. So, and then there's Lambie.
Yeah, so I'm actually going to turn on my camera, hopefully. Oops, no, I just shut it back off again. Okay, so one of the other things that came up and was talked about at the conference is, can I turn my blur off? I think that's going to be. So, I could stop share too, make that bigger. So this is a book, Lambie Learns, and it's about addiction. So, and it comes with this little lamb, which is really not a lamb, but a bunny. And it is, yeah, because things aren't as they seem. And so after Joyce and Jess got back from the conference, they were all excited about this and asked about if we would think that this would be helpful for our CPS unit and law enforcement, schools, to be able to make those connections with kids when there is addiction issues happening with them. You know, brought it through the CPS unit. Everybody was super excited about it. We happen to have also gotten a call from Marshfield saying that they wanted to help support talking to us about Lambie Learns and wanting to be able to donate some funding towards that. So it's all happening kind of at the same time. So we're really blending and braiding resources together as we move forward for funding. You never know when somebody wants to donate money and in support of some of this programming.
And Lambie Learns is a very nice story. It's for young children, right? And that's why they get the money. But it's really a story about it's not your fault. Talk to someone if you're feeling bad. Here's how to cope, kind of thing. It's through the story, and it's just a very short, sweet story. But it's to help give the child a little bit of integrity, a little bit of autonomy back because they're going through such a hard time. And it's a really nice learning thing for children and something for them to hold, that tactile, to hold on to something that makes them feel good.
And I just have, go ahead.
So how would a child get involved with that program?
So if Child Protective Services is out with a family or law enforcement ends up going and making arrests, taking kids in that type of situation, school finds out that there's drug use going on in the home or addiction issues, then that's how that would be connected. All referral. And one final thing related to all of this work is our Medical Reserve Corps. As we move forward, we want to make sure that we're connecting community in with fentanyl awareness activities, both prevention and recovery side of things. And we're actually going to be applying for additional grant money for the Medical Reserve Corps to be able to move forward some of these campaigns to be out and into the community and using our Medical Reserve Corps members to do that work with us. So I think that's the final thing. Oh my goodness.
No, that's okay.
Lots of things happening. So questions? Andy?
I don't have a question. I was just going to tie it back into the opioid funding. So on the budget that Public Health has put together, it summarizes the HHS grant that they're receiving to cover some of these expenses, and that pairs up with the opioid money that the county is receiving. So they've on the last page show that we've already received $121,905. We have received the $4,858 that came in last week, and then the $21,161 for the 23 distribution. We've been noticed that it's on its way, so it should be here in the next week or two. So that's just some upfront payments for the settlement, and then this year's distribution will be receiving more money in following years, generally in the low $20,000 range for another, I believe it's 12 years on the one settlement. And then there's a whole nother settlement, the retailer settlement, that we have not been informed as to what the distribution schedule. We've already signed off on it. It's coming. We just have not received a distribution schedule, but we expect it to be somewhat similar to the Janssen payments, maybe a little bit less, so maybe in the high teens on an annual basis. So there is more. We're not using all of our opioid funds for this. We're just using what we've received to date, and that'll cover us through 24, I believe, for the budget that's been presented. And from a process standpoint, we're kind of running this through like all the committees that are affected, because the opioid fentanyl issue covers quite a bit of impact on the county. It's impacting public safety, law enforcement, EMS. So we've talked to them last week and showed them this. HHS, obviously. The Criminal Justice Committee is tomorrow, and then Finance on Thursday, with the intent of running it through everybody up to the board next week so we can approve the use of the opioid funds for this purpose. A lot of this was discussed in CJCC as far as the opioid funds. There was a lot of ideas, but we really ultimately pushed it in the direction of public health, since they already do the health assessments for the county and they know the gaps. of services and assistance, and they tied themselves in with some of the work being done at the state level that ties into the HHS grant that they're receiving to put together this plan for how to address the impacts of opioids and fentanyl, because I think we've covered it last month. It is significant. It's impacting the services we provide to the county. I think it's significant on our EMS and law enforcement. And I did want to point out on the third page too that you'll see more. I mean, a lot of this is awareness and marketing and getting the word out and making everybody aware, reaching out to kids, reaching out to the community. There is a law enforcement piece that's already in process. We've been awarded another grant for the pre-arrest deflection program to deal with offenders. And then also you'll start to see now that the second courtroom's up and running and the second judge is taking the bench next week. That'll mean our treatment court will be up and running. So you'll see people who are actually being prosecuted for drug offenses will be able to have the opportunity to go into drug court and get those services and the therapy so that we don't see the recidivism of them returning to the system, essentially. So there are other components of this that are already in process. And then we have some other things coming down the road, we think, with more services into the jail and services for those who are fighting substance abuse. So,
Julia, is there another county that has instituted a similar program to this? And what is their success rate?
Some of the counties are doing awareness campaigns. They're just all getting starting. Most counties haven't been really spending their money yet. Everybody's just trying to figure out how, what to do. There's not a lot of money. So, a lot of people want to throw money into treatment facilities and different things like that, but there's really not enough to really do that with. What we have seen in prevention is really looking at, connecting people to those resources. So not only making the awareness out there, but we also need to connect them to those support services. So that's why we feel like School Pulse and connecting to some of that. Actually, there's a brand new phone number. There's so many things happening right now. My big thing is not just to advertise and not just to say, hey, this is what's happening, but what is our ask of the community? And it's really connecting to those resources. And so I think that's where we see the big gains here.
And I guess I'll jump in because we talk at an administrative level. I like everything Julia just said. A lot of other counties are just getting in. All the counties just started getting the opioid money in the last 6 months. So they've been working on how they're going to start using it. What I've taken away from Sawyer County versus those in our neighborhood, at least, is we have a problem. Most of the counties around us don't have an opioid problem, at least not yet. When this discussion started a year ago, when the opioid money was coming, people were talking about meth a little bit, just, pretty, not fentanyl, not opioids. They don't have 9 deaths in 2003 or 11, if that's where we're at. So we have an opioid problem here that other counties near us are not experiencing. I think they're starting to see it. I mean, just Narcan. Our deputies or ambulance use it weekly. There are counties nearby us that haven't used it yet this year. So I think our approach is a little different than what you're going to see in other counties.
And I think the additional piece is we don't want to we don't want to just think totally about prevention. We need to think about the harm reduction. We need to think about how do we get people connected to treatment. And most importantly, at least in my mind, is if we've gotten somebody into treatment and they're in recovery, we need to make sure this is a safe environment for them to stay in recovery and feel well supported. So those are those pieces that we want to, especially when we're getting into the pre-arrest deflection and the drug court, those types of things. It's to create that recovery safe environment for people.
I don't. There's no raise your hand.
Dawn, we can hardly hear you. Can you try that one more time?
I don't have a button to be able to raise my hand. You hear me?
Yes. Oh, I tried, oh, I'm gonna turn this one off.
Can you hear me now?
Yes.
Yes.
I totally am, for what you're doing. I'm not gonna poop. This isn't to crap on that. But sitting here, my blood pressure my heart rate went up to about 114. I'm sitting here going, we've had an opioid problem for 2 years. I work for the university. Fentanyl has been laced into the drugs because it's cutting the drugs, and they're making a bigger profit because they have to use less of the drug. Fentanyl has been on the reservation for more than 2 years. It has been within Sawyer County for more than 2 years. I'm for these programs, well, we don't have the resources. We do not have the programs or the therapists in our area. So where are these people going? Because I know I can't even get a root canal in this area with my insurance. So we've talked about this for this is about my 5th year in. Where are these people going? We don't have the programs. It's great getting the grants and doing the programs, but people are dying. They're county going someplace else and fentanyl overdosing. Narcan's great, but it's not the solution. I know we got the vending machine and stuff. It's just the okay, Narcan, and here we go. We are saving the lives. These people these individuals get up and then refuse, or they're hit with Narcan 3 or 4 times. And they continue to use because there is no programs in place to help them beat their addiction and overcome it. It's mental illness, it's society, it's how the traumas they faced, their parents being assimilated, all of it. We can keep beating around the bush, but again, the doors have not been broken down up in Madison to get us what we need here. And this is where I've attended so many funerals or had to write so many condolence letters. It is not funny when you're living in Winter, Wisconsin, and this is what surrounds our community. For us to be below Milwaukee is absolutely astonishing to me. We should have programs. We should have doctors. We should have facilities. We have nothing. We have nothing for anybody here. Our kids, by the time those kids hit the button, it's too late. Mom and dad are heavily addicted, and children are terrified to say anything. I'm a first kid from Chicago. I certainly know what meth is. I certainly know what fentanyl is. I certainly know what cocaine is. I was born in 70, raised in the 80s and 90s, and it's the same what I've been eating for 3 years or more, that we don't have it here. And it's just continued to grow. The deaths on the reservation have topped 30 tribal members, 30 from a very small tribe that we have lost, and their grandparents are now, which are grandparents, are raising their children. They're in their 60s. This is out of control. I can't believe anybody would state that they didn't know we had a fentanyl. Or an opiate issue. This is all we've been talking about in HHS. It's just beyond me. And yes, Lamb, the rabbit, little kid gets, CPS goes out there, but it's reunification. And I've been in some of these reunification situations. My son-in-law was one of those. And I came to the county for help, and my son-in-law went into the military to break free of what is going on within our county, to not get lured down that track. He's now out, served his 5 years, and he's out. I'm very proud of him. But this is the trap. It's generational here. That's the issue. And there's no help for anybody. I'm done.
Thank you very much, Dawn. Okay. Where are we at now?
Fiscal.
Hmm?
Oh, do we need to, yes, sorry, we do.
Yeah, I think it'd be good for the committee the board, excuse me, to, like we had in public safety, if you're in favor of moving ahead with the budget and the expenses as outlined, to make a motion in favor and forward it on to the finance committee and to the county board.
What's the pleasure of the board?
I would be in favor to make that motion to move forward to the finance committee.
I'll second that.
Okay, we have any further discussion? Hearing none, everybody in favor, say aye.
Aye.
Anybody opposed, same sign. Motion passed. So this goes on to the county board.
Fiscal report?
Hmm?
Fiscal report?
Oh, yes, yes, yeah.
Anybody have any questions for Patty? She's here to answer any questions for you.
Performance report through last month, as well as the purchase service recap, which I explained during the budget process and how that goes, what that outlines. And that is through June. Any questions from anyone? Okay, thank you.
Thank you.
I did have one question. So, I can't find it right now, but, the services that, we provide as a agent of the state, we're in the hole. And when we first were talking about that, it was going to be self-supporting. So why is it not at this point, and what can we do to get rid of that deficit?
You're seeing the income come in. It comes in usually May, June, and July. So it's just now really coming in because we don't even send out our bills until the beginning of May.
The
So
licensing?
for the licenses for the year. Okay. So you're still seeing a lot of that hitting the books.
Thank you.
Anybody else?
And we'll keep watching that. We'll adjust our fee schedule as we move into the next calendar year to make sure that we cover our expenses.
We did do that.
We did for
Just-
water, but
just-
not for the licenses. We haven't
Oh.
done that for quite some time.
Oh, well, then we need to get
Yep,
on
we're going to do that for
Yeah.
this next
Yeah.
calendar year. Yes.
because we can't afford to lose the
Mhm,
income.
Especially with all the short-term rentals.
Yeah.
mhm.
When
Yep.
we did the 2024 budget, that was projected in with the budgeting
The increase.
Mhm.
increases.
Where are we? Purchase services reports. Did you?
Yeah, the purchase service recap, that was part of what
Yeah,
I,
that was what you just did.
Yep.
Thank you.
Patty, I know billings always lag or invoices lag sometimes, but any red flags?
at this point in time, no. I mean, the only red flag really is that you're seeing a huge increase in your juvenile justice out of home costs. But we've reported on that several months here now, that is just the reality of what is happening. We actually have where we are needing to place out of the state because we don't have enough facilities that will take the children in state. So that even increases our costs more.
And that's being echoed in all counties that have juvenile issues, that there's not enough facilities in state to place the youth in. So like Sawyer County, people are going to Illinois, Kentucky, Missouri to facilities that will take them.
Correct. But that does create quite a burden
Mhm.
financially, because not only are those facilities more expensive, but then you do have to have the cost of, you have to have contact with the people that are placed there, and it's not just by phone, you have to go see them.
This facility is, what was the one that the state actually shut down? Lincoln
Lincoln Hills
Lincoln
is on
Hills.
the decline, but it is not, that's the state prison for youth, but it's still going. They had just planned on downsizing it and then opening a second one and having 2 facilities in the state. That hasn't happened yet. But what we're talking about is more residential caring centers, and especially ones that take not only troubled youth, but mental health issues.
Okay.
And you are also seeing mental health issues compounded with maybe developmental delays or autistic delays. So they're very specialized. And we also had a large facility, residential caring center, Eau Claire Academy, which was close, that we used a lot in Sawyer County, close this year. So it's impacting us greatly of having options.
Yeah, thank you. I wanted to be clear on what types of facilities you were talking about.
Yes, mostly residential caring centers.
Okay. And why did the one in Eau Claire shut down? Just lack of funding?
Staffing.
Staffing.
You can't hire anybody. I don't know, anywhere.
Thank you.
Yeah.
Okay, future agenda items.
Is there any specific reports or anything that the board would like to see?
No, I think
Okay.
just continue as you have been.
Okay.
I'd like
That's
to
good.
see how this progresses along.
Yeah, I know that we'll be tracking the number of touches. They already have started tracking those pieces. So as we go along, we'll definitely have a performance report that goes with all of that.
Okay, in that case, we're adjourned. Thank you.